If you are experiencing pain in your shoulder with certain movements like reaching over your head or behind your back, it could be that you just need to work at strengthening the rotator cuff muscles. Today I'm here to help you out with learning more about what the rotator cuff is, what it does, and some strengthening exercises that may help to increase your shoulder stability and decrease pain. I will also go over some movements that you should not do in your daily and work activities, as that could be contributing to your shoulder pain. If living pain-free equates to a better life for you, keep watching to find out more what you can do to live your best life. Welcome to Better Mobility, Better Life, where you can learn how to break mental and physical barriers to become a better athlete, a more functional human, and how to age with grace using physical therapy techniques. So what is the rotator cuff? The rotator cuff is a set of 4 muscles that serve to stabilize the shoulder joint. The shoulder joint is a ball and socket joint that is the most mobile joint in the body. Because it can move in all 3 planes, it makes it less stable. The rotator cuff muscles need to work together in order to keep that ball rolling and gliding in the socket appropriately. Looking at the shoulder, there are 3 muscles in the back of the shoulder blade and 1 in the front that forms the rotator cuff to hold the ball in the socket. If the ball is not sitting appropriately in the socket, then over time this can cause pain and pinching and probably lead to a rotator cuff tendon tear. You may have also heard people call this shoulder impingement, where the tendons and the subacromial bursa sit between the shoulder blade and the ball, and they are pinched due to the ball not moving how it should in the socket. If the rotator cuff muscles are weak, then compression will continue, especially with overhead movements or reaching behind your back, and it will start to cause that pain on the top of the shoulder. In the link below, I have a video where I go more into depth on shoulder impingement, so click the link if you feel that is what you're experiencing. Today I want to show you my favorite strengthening exercises for the rotator cuff. The external rotators are typically weaker than the internal rotators, so a lot of the exercises that I have focus on the external rotators, which sit on the back of the shoulder and they bring your shoulder out this way. The internal rotators go back the other way and they are stronger, so don't worry, I'm not going to leave those out. Please note that this information is purely educational and not medical advice. There are many causes of shoulder pain, so please use this as a guide. If your shoulder pain persists, I advise you to see your trusted PT. All right, so the first exercise that we're gonna do, again, they're going to really focus on those external rotators. You're going to get on a yoga mat or on your bed. You're gonna lie on your side with your affected shoulder up. What you're gonna do is, you're gonna start with no weight initially, and you're gonna just rest that shoulder on your torso, and you're going to bring that shoulder blade down and back again, get that good posture, and I'm gonna have you come up in the air with your wrist. So it's like you're just opening up that door. I want you to do 3 sets of 10 with this. If this causes a lot of pain, I would just hold off. But if it is tolerable for you, go ahead and do that, and you should feel a little bit of a burn on the top part of your shoulder. When this gets easy, you can progress it with a little bit of weight, and a water bottle is a great household object that you can use. It's about 1 pound. Again, you're gonna grab that weight and just rotate up to the ceiling here. 3 sets of 10, and then relax. Another way that you can train your external rotators is if you have a Theraband at home, you can grab it with both hands and keep your thumbs in the upward position. So here, I'm gonna have you squeeze those shoulder blades down and back. You're gonna open up that chest, and you're just gonna pull out nice and lightly with that band. You should start feeling those muscles on the outside of your shoulder start to burn. If this causes a lot of pain, I would just hold off until you see your medical professional. So for our next exercise, this is a progression from doing those shoulder blade pinches, holding the shoulder blades down and back, by adding a little resistance. I have here a resistance band, and what you can do is tie a knot in the middle of it and put it into a door, shut the door, just make sure nobody is gonna open it from the other side. Another thing you could do is if you have a pole or a banister at home, you can just wrap it around that banister, something nice and stable that won't move and won't shift that band. Then you're going to hold the band with both arms extended, and the shoulder blade is gonna lead the way. So you're gonna squeeze those shoulder blades down and back and pull so that those elbows come right to your torso. And then release. The next exercise that I would also have you do is almost the same thing. You're gonna take those resistance bands and this time you're gonna pull down towards your hips, and I want you to squeeze those shoulder blades down and back. This one is a little bit more difficult, so you might have to loosen up on your band a little bit. And again, lead with those shoulder blades down and back, pulling towards your hips, hold for 2 to 3 seconds, then come up. And I would do 3 sets of 10 with this one as well. So we're just re-educating those shoulder blades to work and bring that shoulder backwards so that it prevents you from going into that forward motion. For your internal rotators, you're going to just take the band in one hand and you're gonna start out to your side. Keep that elbow tucked in. You can stick a towel roll between your arm and your torso, and you're going to just pull nice and slowly towards that belly button. Again, keep your good posture, and 3 sets of 10 is what I recommend. This will get the internal rotators nice and strong for that rotator cuff, for all those rotator cuff muscles. So to wrap up, those are the best exercises I have my patients do when they have shoulder impingement or instability. I showed you a few exercises using the dumbbells, but if you're able to get a hold of a resistance band or cables, then I tend to like those better. If you've enjoyed this episode and you want to learn more about shoulder impingement and approaches to relieving the pain, make sure to subscribe to this channel and then click on the video below.